You're watching NBC6 News at 5.
NBC6 keeping you updated on the coronavirus pandemic across the country and throughout the Arklatex.
Governor Greg Abbott has been gracious enough to take time out to share the latest on the situation in Texas. Governor, thank you very much for joining us and thank you for your leadership.
And my pleasure. Thank you, guys.
Now, at last check, your Health and Human Services website showed Texas with 972 cases and 12 deaths. One death, of course, is too many, but certainly Texas is not being hit as hard as many other places in the nation. So why do you think this is, and what are you doing to keep the numbers low?
Well, understand this, and that is we are dramatically increasing the number of tests that are being administered every single day. So one thing to expect is to see the number of people testing positive to increase. Also, we will be identifying probably more cases of people who are passing away because of COVID-19. Don't be alarmed by this. This has been expected and been anticipated. So what we are trying to do is to make sure we are responding as aggressively as possible to make sure that every Texan will be as prepared to deal with this. Hospitals and healthcare providers will be prepared. But mostly in Texas, we're trying to slow the spread of COVID-19. These executive orders that are issued, as well as some executive orders that have been issued at the local level, collectively are making sure that we are distancing ourselves from each other in ways that will reduce the transmission of COVID-19. Very important for everyone watching this right now. Do all you can for the next 2 weeks to reduce your interaction with others so we can reduce the spread of COVID-19.
Now, Governor, there's been a lot of backlash after Texas's second-in-command, Lieutenant Governor Dan Patrick, made comments in essence saying that seniors would take their chances with the virus in exchange for getting Americans back to work. His comments contradict what you just said there. Is there a mixed message coming from the state?
Listen, I think one thing that we can all agree upon, and that is that every life in Texas matters, and that we want to make sure every life is going to be protected, and that we as a state are all in with all of our strategies to save every life. And that means this program of everybody working together to reduce the spread of the coronavirus, while at the same time the state of Texas is providing every resource possible to our healthcare workers so that they will be able to take care of those who do contract COVID-19.
Now, President Trump has declared a major disaster in the state of Texas. How does this help you with the resources there?
We're very pleased about this being granted today, and it unleashes far more resources to the state of Texas from the federal government, typically flowing through FEMA. We are now increasing the number of tests that we will be able to administer, whether it be collecting COVID-19 specimens or in testing for it and identifying those who have it. Understanding this, the primary goal and purpose of a COVID test is to identify who has it so we can isolate them so they do not transmit that COVID-19 infectious disease to anybody else.
Governor, we have about 30 seconds here. Share with us the waiver that you have in place to ensure the additional hospital capacity you may need during the coronavirus pandemic.
This is something we work on a daily basis. We're identifying the number of beds. I issued an executive order yesterday requiring all hospitals in the state of Texas to notify us about what beds they have available so we're able to maintain full capacity. We know where there are shortages so we can provide additional beds where needed.
All right, Governor, thank you very much for your time. We appreciate it.
Stay with us. Chief Meteorologist Todd Warren back with the final check of your forecast coming up next.